medical coordinator in the country. He joins us now from Herat. Dr. Hai, thank you very much for taking the time to speak to us. I know that you are overwhelmed. If you can just give us a sense of where you are, what the situation is. I saw an email from you a little bit earlier. You were talking about internally displaced people and what you're dealing with in your immediate vicinity.
Yeah, thanks, Robin.
Hi.
Good morning.
Hi.
You're right. We should clone ourselves here to do what needs to be done. We're dealing with tens of thousands of internally displaced people scattered in the outskirts of Herat seeking medical care. We are one of the only left providers of healthcare here. The other thing which is very concerning here is malnutrition. So we see babies here. I've seen a young boy yesterday, 18-month-old, sort of down to skin and bones to his birth weight, about to die. We could just put a tube in and try feeding him. The next component, of course, is the pandemic. We are in between the third and the fourth wave of Corona, which there is no help, not enough oxygen in the country. There is not enough ventilation options here. And of course, vaccination is not available as it should be. So we are fighting on many fronts here, and it's not easy.
It's not easy. Just talk us through how many people and how many doctors you have and how many people you're trying to treat a day. Just the practicalities of what's going on the ground.
Yeah, we see for this internally displaced people, we see about 400 people coming to our day clinic, which are there seen by doctors and nurses. For the malnourished children, our beds, which were set up to serve about 40 young babies, it's now we have a bed occupancy rate of 250 beds, so up to 3 babies have to share one bed. Our doctors and nurses working day and night. They haven't seen a weekend for months. And for COVID, we screen about 100 patients every day. About a dozen are severe cases, which we then transfer to our COVID center. But that's at the moment. It's fluctuating every day. And of course, we are asked to do much more. Entirely, health systems are collapsing on the right and the left of our work here. And of course, we're trying to get in new doctors, more nurses. Logistic is a problem. Also medical supply. The airspace has been blocked over Afghanistan for a long time. The borders were closed, so we hope now to get people out who have worked here for months without a break. Yeah, it's still challenging, and we know it's autumn. Winter is coming, so respiratory diseases. The pandemic will come back in the next wave. So we try to cope somehow.
The UN is warning of a massive humanitarian crisis, about more malnutrition, about hunger. What are you seeing, and how concerned are you about that and that warning?
I am, because the majority of health services in Afghanistan are funded by external donors. We as MSF, as Doctors Without Borders, we are in a little less troubling situation when it comes to funding, because all our medical care here is free for the Afghans, and it's coming from private donation. Yeah? So all individuals around the world supporting the organization make our work here possible. We are able to still continue paying the wages. That's different to all our doctors in the national service, who haven't received a salary for months. But of course, this is it's challenging to keep up the minimum healthcare that is still available. And instead of getting more, we need more. Yeah, we see with the lack of funding, it's going down. So this gap is increasing, and I'm not sure how difficult it will be over the winter to cope with all the new challenges that are coming up.
Okay, Dr. Tancred Stobbe and all of your colleagues there on the ground in Herat, thank you very much for the hard work. I know you're exhausted, but thank you, important work. Appreciate you also joining us here at CNN.
Thanks, Robin.